Hi, I'm Dr. Nick Denson. I'm an obstetrician gynecologist at Monarch Healthcare here in Idaho Falls. Robotic surgery is a minimally invasive approach to surgery that allows for complex surgeries to be done with incisions less than 1 inch. So while there are many types of robotic surgery available, today's focus will be on gynecologic surgery for women's health. Compared to traditional laparoscopic surgery, it allows improved dexterity and visualization for the surgeon performing the procedure. So many women may benefit from robotic surgery. Up to 1 in 4 women are affected by uterine fibroids. Pelvic organ prolapse or loss of support in a woman's pelvis affects as many as 1 in 3 women who have 1 or more children. Endometriosis affects up to 5 million women in the US alone. This may in turn cause pelvic pain or bleeding issues. For women with history of preterm birth who failed other attempts at cerclage, robotic cerclage may allow them to carry their pregnancy to term. One of the most common surgeries that I offer for women is hysterectomy, or removal of the uterus. Reasons for removal of the uterus can range from bleeding to pelvic pain. Another type of procedure that I can do would be removal of large cysts from ovaries while preserving hormone function and fertility. For women with large fibroids who do desire fertility in the future or more children, one of the options that we have available for them is myomectomy, or removal of the fibroids to treat pain, bleeding, or infertility issues. So a typical OR room layout for robotic surgery involves a surgeon console immediately at the bedside. This is adjacent to the robotic arms, which are on a stand that go directly over the patient during surgery. Within the surgeon console is a 3D viewing screen to allow very precise visualization of the anatomy in the pelvis. The arms are controlled from this console. However, there is a safety mechanism in place so that if the surgeon looks away from the surgery, those arms are locked in place to prevent inadvertent movements. One of the advantages of these arms is that even the finest tremor by the surgeon hand is filtered out by the technology in the robot. So one of the most common misconceptions about robotic surgery is that the robot itself does the surgery. This isn't a machine that I programmed to defrost popcorn and go and grab coffee down the hall. In fact, if I remove my head from the surgeon console, the arms are locked in place. This prevents any inadvertent movements on the surgeon's part that may cause unintentional harm to the patient. Another common misconception is that due to the complex nature of the technology, it's going to cost a lot more than traditional laparoscopic surgery. In fact, a standard hysterectomy done with 3 instruments costs less than the traditional laparoscopic surgery often compared to it. Lastly, one of the other common misconceptions about robotic surgery is that the increased dexterity requires larger incisions and more of them. In fact, the instrument tips for the robotic surgery are smaller than a penny. Another option for some patients is the entire surgery being done through a single umbilical incision. This leaves virtually no scarring. Certainly not all patients are going to be candidates for robotic surgery. This is a conversation you should have with your healthcare provider to find out if there's a robotic surgical option that can treat your personal needs. If you'd like to learn more about robotic surgery, contact me at Monarch Healthcare or get in touch with your healthcare provider.